Hello everyone, Valerie
Hi,
Stern and I are here. We're both trying to be in the picture, but it's more important that she is in the picture because I'm here to interview her because she is a mold expert, and this is a subject that sadly a lot of people have this condition which can be debilitating, and it's not diagnosed, it's misdiagnosed. And so we're here to try, because it's a difficult subject, to simplify and make you understand, because there are a lot of people out there who have this, who need to understand what they got and how to move forward. Step 1, step 2, step 3, about how to be diagnosed, what to do, and the hope of, what do you do about it to be ameliorated. If you have the gene, you can't be cured, but you can still be ameliorated, etc. So Valerie is an expert, number one, because she genetically has it, okay, and
Lucky me.
it's something that, it's not something that you know about, and it's something that also in people who, with vaccines, impacts reactions to vaccines.
Absolutely.
So let me start by asking Valerie, number one, because there's nothing better than personally having gone through something, particularly if you're a health practitioner.
Very much so. I couldn't agree with you more, and
So-
I'm glad we're discussing this as well. I think it'll shed a lot of light for you out there
Who are
and-
suffering.
Exactly, or maybe give you some hope and give you some idea where to turn to if you're feeling sick, but you're just not
having
getting
these
diagnosed.
these symptoms. Okay, so let's talk about how did mold, the journey of how did it start? So when you were growing up, what did you experience and the reactions that people said?
Basically, as a child, I'm one of 5. We were all within 6 years of each other, so we were all small at the same time. We were in and out of allergy clinics our entire lives. We couldn't have pets, or we'd have pets, and 1, 2, or 3 of us would be sick from the pet.
And sick means what?
Sick basically means eczema, hives, asthma, runny noses, watery eyes, swollen faces, inability to just feel normal or carry on because you're just running around blowing your nose or itching your eyes or scratching at your skin constantly.
Okay, so that is often, certainly, you end up going to the allergist,
Right.
you go to the dermatologist, and they give you steroids, they give you things that are just treating the symptoms.
Exactly.
That are not diagnosing you or trying to figure out why do you have this and treat the why. Okay, so those are things that can be very nebulous, okay, that again, no doctor would think of something like mold because again, it's an unusual, it's not a huge a diagnosis that you see, but increasingly we're seeing it, which is also why we're talking about it, because there's an increasing amount of homes, etc., that have it. So, all right, as you progressed forward in life, because we're going to talk about the accumulation of the toxic load from chronic exposure to mold toxins, particularly if you're very sensitive versus and have the gene versus somebody who doesn't have the gene. So how did it progress for you?
Basically, you just learn to live with it. You learn to adjust. You
Symptom-wise?
Symptom-wise, headaches, again, rashes, feeling sick, feeling brain fog, muscle aches and pains, things that never really added up because they were different body systems.
Yeah.
And that's important because one person may have a migraine from it. I may have joint pain or a rash or something. So,
or some symptoms of rheumatoid arthritis, that sort of thing.
Exactly. And so basically to diagnose somebody with mold, you have to have multiple systems involved. That's huge. Somebody that says, oh, I just have eczema, that's it. Okay, that's eczema. But if somebody says, but I've got brain fog, I am,
my joints hurt.
My joints,
and there's
my hair's
thyroid that makes you think of a lot of things like
exactly.
that. Okay, so let's talk about as it progressed, okay, as the toxic accumulation, the toxic load, and what that's defined by, and correct me if I'm not specific here, what that means is you become the toxic load where you start having more and more symptoms are because you basically are becoming increasingly inflamed internally as a reaction to your body being allergic to these toxins, specifically mold, okay?
This is correct, but I'm just going to back up for 1 second because it is an allergy, yes, but it's also a poison. And so what I want to bring to the forefront is that many people will go see an allergist, immunologist, which I've seen many. And I was told, oh, you're fine, you know, it's an allergy, whatever. Okay, no problem. I'm sure that's very true because allergy medicines did help to a certain degree. But it didn't help me when I couldn't think clearly or when I couldn't process new information into long-term memory. I couldn't find my way home or whatever. There are certain molds that can cause allergies, and there is a subset of molds that are molds but produce what are called mycotoxins. And it's these mycotoxins that somebody like me or anybody else that carries this particular HLA gene have, where we don't process that and we basically become poisoned. And as Dr. Hunter
increasingly poisoned as you go through life.
Exactly. So as she pointed out, the fact that this is a toxic load that's getting this little glass of water drops, so to speak, and each drop is something toxic. It just keeps filling up more and more and more.
And your body can't rid it. And so antioxidants help.
Antioxidants help, absolutely.
But they're just treating the symptoms. And what we're looking for is helping you diagnose if you've got the cause.
Exactly. And, you know, they do help, there's no question. But like you said, unless you know what you're dealing with, it's hard to decide how you're going to treat it.
Best treat it.
Exactly.
Okay, so then let's talk about the whole canary in the coal mine. Yes, increasingly you get brain fog. You're not, you know, you just know you're not right is the nebulous term. And you're increasingly not right. And you can be a smart, put together, focused person normally, but you're increasingly not right. And so let's talk about the canary in the coal mine, as they call people who have mold propensity, okay, genetically or otherwise. Some people can't detoxify, so they assimilate it when they're exposed to it. Am I correct on that?
Absolutely.
Okay, so canary in the coal mine, address that.
Basically, the canary in the coal mine name, it comes from the fact that there are certain people out there that have what's called an HLA status, where their bodies do not recognize. That's a gene.
And what's that gene number in case they need to be tested for it?
HLA, it's your HLA DRDQ. And
DRDQ, that's, you get tested for that if you're really, well, you should get tested for it if you think. That's a blood test.
Exactly.
LabCorp, you can get that from LabCorp.
Absolutely.
And Quest.
Exactly.
Yeah.
And the other thing too is it'll give you just a plethora of information, not only on mold, but on other things too. So why would
vaccine weaknesses,
exactly, mold
issues,
propensity, vaccines, other conditions with your skin, all different types of immune related issues and just things that your body does not tolerate. So why did we do that, or why does somebody do the HLA gene? The canary in the coal mine is somebody like myself, for instance, where I can walk into a room and immediately tell you, I got to get out of here. I can't be in here.
And what symptoms do you have?
My throat starts getting hoarse. I'm clearing my throat. I start to sneeze. I start to get agitated in some instances. Other instances, I become attention deficit. I can't focus. If it's around sunlight or whatnot, my eyes will not focus. And I become overwhelmed to the point where I almost feel like I'm autistic. And I would never have understood somebody telling me that until it happened to myself, and now I get it. And I feel terrible that I didn't understand this, and it took me getting it to understand.
And why you need to know, if you got it, that you're not crazy.
Exactly.
Because people tell you, and certainly the medical profession suffers from saying, oftentimes, oh, you're just stressed and da-da-da.
Exactly.
When in fact, you have a very legitimate, very compromising that needs to be treated, and you can be treated successfully, genetic condition. And some people are born. So what backgrounds, different Norwegian, da-da-da, that are the canary in the coal mine, where you send them into a building,
right,
and they say, oh no, it isn't good.
It tends to be all individuals. However, what some research has found, and it's just the research that I've looked at and so forth, was based in kind of the Scandinavian areas. And they discovered that individuals from these Scandinavian countries tended to have this HLA gene more often than people from other countries did. Why, I don't know. Maybe it was protective for them at some point.
Yeah.
But now, of course, it's an environmental maladaptive type of situation. Maybe not. Maybe, being the canary in the coal mine is warning all of you to stay away.
Right. So there are people who manifest this clinically, who have like sick house syndrome.
Absolutely.
Where they go in houses and these houses make them sick. They can't live there.
Yep.
I've certainly had patients like that. You've had plenty of patients
Ed
like that.
McMahon is a perfect example. Ed McMahon, who used to be a nighttime TV entertainer.
Yeah, with Johnny Carson.
Bianca Jagger.
Yeah.
I could go on and on with many names of many people that have undergone this same situation. And like you said, had to leave. And in some cases, these properties needed to be demolished. They were so toxic.
Okay, and they were toxic with mold.
Yes.
Okay.
Mold and what's called endotoxins and actinomycetes, because the three all go together. Though mold is the one that's probably the most well-known, and people will refer to it as a mold illness, there are other factors that are now being discovered, those being endotoxins and the actinomycetes, that all play a role in this internal inflammatory response that we develop in causing our symptoms.
And can't tolerate, whereas
Yes.
other people may have no reaction at all. But these are people who have a genetic propensity, and genetics are increasingly everything in medicine today.
That brings up a good point, and I'm so glad you said that. What she just mentioned is key. You need to understand that you could be your own person. You could be a family of 4, 5, 6, 7. You could be the only one experiencing this.
The only one that's got the gene.
Exactly. Or you could find that you're experiencing it in one way, but maybe your child or your spouse or whomever else is living with you is experiencing something completely different.
And also as you go down the path of life, because again, the amount of toxic load, some
Yes.
people tolerate the toxic load longer, better than other people.
Yep.
Some people can't detoxify because they're born missing enzymes. There's so many enzymes in your body. And so some people, one sibling will have it and another sibling won't have it later.
Absolutely.
The other thing is, am I correct about multiple chemical sensitivities can be, you need to think about mold as well for people who have that.
100%. Guilty of multiple chemical sensitivity also, as you well know,
Yeah.
working in the practice. It's an absolute nightmare. It is not a psychological issue. It is not something that we make up to get attention like we're told. It is real. And it is debilitating beyond belief. When you have to go grab an EpiPen, you can't breathe and you need to shoot yourself with epinephrine just to breathe because of the toxicity in the air or the perfume or whatever it happens to be.
And talk about those smells. Okay, as far as the canary in the coal mine, how also another hint
Yes.
that you may be affected by this is about the smells.
Yeah, this is sad but true. My own experience. I live in Los Angeles. I live in a condominium. I can have my windows open, and if somebody walks down the street wearing perfume, I start going into anaphylaxis. It's that bad.
And anaphylaxis means that she starts having a reaction, her throat closes, she gets hoarse, etc. But growing up,
Yes, dryer sheets, perfume, exhaust, certain
when the gardener comes and blows,
certain
Yeah.
or
Gas
essential oils. So some people will say to me, oh, it's organic, or oh, it's an essential oil, it can't cause any problems. Yes, it can for us. We're a unique
For the
group.
canaries in the coal mine.
Yes, sadly, we're a very unique group, and we are the people that end up isolating ourselves from the world because we can't get on an airplane or we can't walk through the supermarket without experiencing these things when we come into contact with others.
And you smell things that other people don't smell
Exactly.
at all.
Exactly. Our sense of smell is so keen. I remember as a child and as a young adult being told I had the nose of a bloodhound, and I was embarrassed by that. But in a sense, it's protective for me because my body will not tolerate these things, so I need that.
So you would remove.
Exactly.
Okay, so let's deviate for a second to those people who may not be HLA DRDQ gene positive, but they're in a house where the window unit of the air conditioner has leaked and there's water damage underneath, because increasingly this is a problem in today's world. There's so many joints and things in plumbing. There's slow leaks, there's leaks you don't see, there's leaks that go down in the wall, there's water leaks from above, there's in the basement where water's down at the bottom and the foundation of the house is not sealed or built or whatever the way it should be. So the people who may not have the gene, but what sort of reaction do they have as mold or these endotoxins or the actinomyces accumulate? Because you don't know which one's accumulating.
Absolutely, you don't know at all.
It depends.
Some people may do well. One thing we do need to keep in mind is it's going to depend upon your own personal health as well. So if you're somebody who, I'm a very clean eater, I don't smoke, I don't drink, I take a lot of supplements and things of that sort. So when I became ill from this, it was a little more difficult because I was already trying to balance out, just naturally trying to be healthy. So I was already doing away with some of the inflammation.
So you could deal with more toxins, a higher toxic load, because you were taking your antioxidants, your glutathione, all the things that you take that help protect, and you were eating healthily. You weren't accumulating toxicity from other things.
Exactly. So if you have somebody who maybe has other issues, metabolic issues, weight issues, they smoke,
high blood sugar, etc.
High blood sugar, absolutely. Triglyceride levels that are high. Any of these things that have...
Or other genetic challenges.
Absolutely.
Yeah.
These are all things that are going to play a role. So even though you may not have that HLA positive gene, where your liver is basically saying, I don't recognize this as a toxin, your body still can become toxic to this stuff. So you have to keep that in mind as well.
As you're living in these places.
Exactly.
So, do you, if you ultimately open the air conditioner, you see all this black mold, or you have a place where the carpet, you pull up the carpet, there's black mold underneath there. There's different sorts of mold.
Oh my goodness, yes.
And some people react to it depending if they've got the HLA what is it?
DRDQ.
DRDQ. Okay, see, I don't know it either.
It's okay.
DRDQ gene. Okay, so when in doubt, so those people symptomatically, they may just have runny eyes, runny nose, they feel sick, they don't feel well, and they used to be well and robust, and their brain is foggy, and you work up people's hormones, you work up their thyroid, you work up, as a physician, health practitioner, you work up everything blood work wise. But what's some blood tests just in case that they should throw in? Number one, don't you think everybody in the big picture, if you're getting blood work and you're having any of these and you even think that you've got any of these symptoms, should you have the HLA-DRDQ gene done? It's not an expensive test. It's one generally insurance will pay for. And then what's the other one? The melanocyte stimulating hormone.
Exactly.
And why do you throw that one in? MSH.
The melanocyte or melanocytic stimulating hormone test is a inflammatory marker, number one. It also correlates with something called Marcons. Marcons is a test that we do very much like we've all been exposed to COVID and doing the COVID tests with the nose. So basically, Marcon's is tested in the nose, and Marcon's is what is known as a biofilm of bacteria that's resistant to just about every antibiotic out there for the most part. It lives in its own little world, in its own biofilm. So basically,
and that biofilm populates
Yes.
your pulmonary, your lungs,
And your brain.
and it goes into your brain, and that's part of what makes you foggy. So
Yep.
you do that Marcon's test, which is not an expensive test.
no, not at all. It's a
And
very easy test to do.
With eczema, don't people sometimes with eczema, because people have eczema, and you think, well, maybe they've got Marcon's, etc.
And
Maybe
also,
they are a mold sufferer.
It's very possible, because along with eczema comes asthma, as we all know. And you see on TV nowadays where a lot of these monoclonal antibodies are designed to target either asthma or eczema or both. So if you've got a patient on them for eczema, their asthma is going to get better as well, and vice versa. So this is a huge point. The other thing is
so doing the Marcon's test, and I'm sorry to
Yes.
interrupt, I apologize, but to be specific for everybody, to do the Marcon's test is an easy enough test to do. When in doubt, if you've got significant asthma or eczema, just do the Marcon's
Yes.
test just to make sure, because we find that people have mold
Yes.
or they are Marcon's positive, and then if you don't treat the Marcon's first,
exactly.
you're not going to get any better,
Thank
no
you.
matter what we do.
Yeah,
Am I
no,
right
she's
on that?
exactly right, and that is a huge point. If you continue to feed the illness while you're trying to heal, you're not going to get any better. You're basically taking 2 steps forward and a step and a half backward every time, as long as you continue to let this Marcon's or this biofilm accumulate. So it must be treated in order to move on and get to the next steps.
Okay, and the other inflammatory marker that they should do, just because if you're inflamed, look, there's the general ones that we all do, C-reactive protein, ESR, the SED rate.
Exactly.
But those are so non-specific for so many different things. Look, you can even do the one for colon cancer, CEA, which
Right.
can be elevated if you're inflamed. The D-dimer can be elevated if
Absolutely,
you're inflamed.
absolutely.
And so the TGF beta is the other one that you recommend,
TGF
which is
beta.
specific.
That's another one that is a clue toward a mycotoxin or a biotoxin illness sort of situation, as opposed to other types of things.
Okay.
There's a few of them, and we can always let patients.
And we
know
can
if-
put a list on the website so that you can click on it. So the most important thing is because at the end of the day, if you have these things, you want to know that you can be cured, you're not going to be negatively impacted for the rest of your life. You have to
Exactly.
recognize you've got something. You're always going to be the canary in coal mine. You're always going to
Yep.
smell these things. There's certain things that you can't tolerate, and but there's a lot that they have found, and there's a lot of information online. Valerie does consultations for people. There's some real mold doctors who specialized in this, because over the years those patients just all seem to come to them
Right.
For whatever reason, and there's certainly societies, but give them some hope about treatment, etc.
And one thing I will say too is that you need to pick your providers carefully, and I know that's difficult to do when this is so
You
overwhelming.
don't know, and you're sick.
And you're sick. I mean, the fact that you can't even remember where you live or what your date of birth is sometimes when you're this sick, it's overwhelming to try to have.
And you're
to
not
do the work.
crazy.
Exactly.
Yeah.
So you want to pick a provider that listens to you and understands. I unfortunately had to go through many before I found one that was like, oh my goodness, this is mycotoxin poisoning. And I cried because it was like there was a name. I initially was told, I've got early onset, late stage Alzheimer's, and I was going to end up in a memory care center. I know, I kid you not, but let me just tell you, asthma and Alzheimer's, as well as many other conditions, all are now being looked at as having a mold base to them. So you need to find a provider that's going to look at you and look at the whole you, a functional integrative provider that's not just going to look at a symptom and give you some biologic or whatnot to take care of the mold or the rash. They're going to look at
They know how to diagnose
Exactly.
you. And also understand that in houses and things, look, they found mold and all sorts of things in sheetrocks. Just think about houses that you see being built and they haven't put on the roof and it's pouring down rain and da-da-da-da-da. And so
completely true. And these are brand new homes, and so people think I'm moving into a brand new property, I'm going to be safe. But just like you said, that lumber has been exposed to the elements for months.
And also, you look always for leaks and things. I mean, you don't want to be obsessive about it, but at the end of the day, you look for things. But people who are symptomatic, people whose noses are always stopped up, yes, it can be food allergies, it can be, but if you are becoming progressively negatively impacted, and skin rashes are a big piece of this puzzle.
Depression, confusion, thyroid issues, menstrual irregularities, your hair is falling out. These are all general basic symptoms.
And it's about the toxic load accumulating. Some people are more sensitive. They don't tolerate a toxic load. They may not detoxify well genetically on top of everything else. So you got to have somebody who is thinking about, why is this perfectly competent person experiencing increasingly these symptoms? And the good news is you just have to be diagnosed, and we'll put some blood tests, etc. on there. There's plenty of doctors out there. There's some societies that we will put some info on there as well.
Absolutely. There are definitely, the internet is a wealth of information. It can be a little confusing to navigate, of course, when you're sick. It can also be scary because there are some things posted that, we don't want you to think are true either. But these societies, these groups, these websites are all there to help, and they have a lot of information to get you started.
And practitioners.
Exactly.
Okay, so knowledge is power.
Absolutely.
There's always hope. You just have to know the questions to ask, because you've got to help your practitioners help themselves often. Okay.
Absolutely.
Whether it's your lawyer, your doctor, your whatever. And so availing yourself of all this information, which is why we did this video. I know it's long, but it's really pithy. Okay.
Definitely.
Thank you. All right. Bye.